Hi, let's talk about stimulant medications. So, stimulant medications is a type of drug class used to treat ADHD or attention deficit hyperactivity disorder. There are two types of stimulants. We have amphetamines and methylphenidates. So, first of all, let's talk about methylphenidate. Methylphenidate also has another derivative, dexmethylphenidate. Essentially, they work the same way. This video is intended for patients. It is not a psychopharmacology lecture, so I have tried to simplify things. For the mechanism of action, methylphenidates work by reuptake inhibition, meaning they block the transportation of these two different neurotransmitters in the brain, which is dopamine and norepinephrine, therefore accumulating these neurotransmitters inside the brain, which leads to increased attention, decreased impulsivity, and overall being more alert and attentive. These medications are FDA approved as a first-line treatment for ADHD for patients 6 years or older. Again, I recommend for patients 6 years or under not to take these medications. We recommend that they try therapy. Also, behavioral modification by the parents has been very effective for patients that are younger than 6 years old. But if they're more above 6 years of age, these medications can help. There are side effects of these medications. All psychopharmacological medications have many side effects because they work on different neurotransmitters in the brain. Each patient may suffer different side effects. Your side effects may not be the same from another person's side effects. So let's talk about it. Possible growth retardation in prolonged use in children. So we recommend that children should have holidays, or they should have a stoppage of medication over their weekends. So they shouldn't be taking these medications on the weekends or whenever they're not doing any schoolwork. Cardiovascular side effects, such as increased heart rate, increased blood pressure, tachycardia. It is recommended to perform an EKG, especially if you have a history of cardiovascular disease. Tics or unwanted movements, excessive movements are possible. And GI side effects such as nausea, vomiting, diarrhea, and appetite suppression, decrease in appetite, and unintended weight loss. Now again, these are some of the side effects. There can be more or less depending on the patient. So let's talk about the medication that fall under the methylphenidate, dexmethylphenidate category. These include Ritalin, Methylene, Concerta, Contempla, Quvilant, Contempla, and Journey. There are other medications with the same chemical in them on the market. These are just the main ones. These medications come in two different forms. You have immediate release, IR. That one lasts from anywhere 3 to 6 hours. And then you have ER. That one can last anywhere from 5 to 12 hours. We recommend to start off on the ER. This one is released much slowly and has fewer side effects. This one, the IR, can also possibly have what we call a crash. So patients that take these medications after 3 to 6 hours might experience a sudden decrease in mood or energy. So let's talk about these amphetamines right here. Amphetamines, lisdexamphetamine, which is Vyvanse, and dextroamphetamine, they are essentially the same chemical. Amphetamine and dextroamphetamine is what's found in Adderall, a combination. Now these medications also work by increasing dopamine and norepinephrine. However, their mechanism of action is a bit different. Again, this is not a neuropsychopharmacology lecture. This is just a generalized lecture. This is intended to be for the general population. So we are just simplifying the mechanism of action. So these chemicals get inside the cells, okay? Basically, they get inside what we call synaptic cleft to increase or raise the level of dopamine and norepinephrine. Therefore, improving your cognition, improving your focus, decreasing impulsivity, and helping you be more alert and give you more energy, okay? These medications start to work almost immediately. The peak action is anywhere from 2 to 4 hours. You will start to see a difference in your energy levels almost immediately on these medications, which is why these medications have a high potential for abuse. Side effects of these medications. Again, cardiovascular side effects. If you have a history of cardiovascular disease, we recommend getting an EKG. Sleep disturbances, if you take it more towards the night. Some patients may suffer from sleep disturbances if they're taking an ER medication at the mid of the day. So it is recommended to take the ER in the morning time because it can last anywhere 5 to 12 hours. GI side effects again can be anywhere nausea, vomiting, diarrhea, and loss of appetite or appetite suppression, which leads to increased weight loss, unintended weight loss.